Imagine this. You're going to bed after a long, tiring day. But suddenly, you remember something. The next day, you have an interview for your dream job in your apartment. But then you also remember how badly trashed your apartment is. Anxiety is the thing that makes you clean your apartment the next day. It's nervousness you feel before a performance, or the butterflies you feel in your stomach when you talk to your crush. But too much anxiety can be like a brick wall, stopping you from living life to the fullest. There are many reasons and forms for too much anxiety. One is called post-traumatic stress disorder, or PTSD. PTSD is caused when someone experiences or witnesses a horrifying event or tragedy, such as going to war or watching a car crash. PTSD can be caused by something as simple as losing a loved one. People who suffer from PTSD may feel anger, sadness, and sometimes even guilt. These people may have flashbacks or recurring dreams and nightmares related to the event. These people may have troubles remembering things, even sometimes important aspects of the event. And a lot of the time, these people have a difficult time keeping close relationships with others. The slightest things that relate to the event can make these people go out of their way and do crazy things, such as changing their routine or driving to work a longer route, just to avoid places or people that remind them of the event. Often, people with this disorder become depressed and sometimes even suicidal. If you know someone with PTSD, you can do many things to help them. You can show sympathy or show them that you care. You have to be patient with them, though. It will take them a while to get used to the world again. Sometimes people with PTSD just need to talk. You can get them a therapist or let them talk to you themselves. PTSD can't be cured with medication, but it can be helped with loving and caring friends and family members. Another form of anxiety is called panic disorder. People with panic disorder sometimes have something called a panic attack. When people get these attacks, they may think they're having a heart attack, stroke, or dying even. Research shows that when people get these attacks, they feel physical symptoms as well, such as faster heartbeat, chest pains, stomach pains, trouble breathing, and these people may have random hot cold chills and extreme sweating. According to psychguides.com, panic disorder can be helped with medication, but it's a matter of getting these people to the psychologist to get them the appropriate treatment that suits them. That's where friends and family members come in. If you are a friend or family member of someone with panic disorder, that means standing up and helping them, not just sitting around hoping they will eventually get better. Relaxation techniques can be extremely helpful for people with panic disorder. People with panic disorder should find the cause for their panic attacks in order to stop it. The last form of anxiety I'm going to be talking about is called Obsessive Compulsive Disorder, or OCD. OCD is not just feeling the need to clean. That can sometimes be a part of it, but not always. Symptoms of this disorder include recurring, disturbing, or unwanted images, aggressive or cruel thoughts towards themselves or others, and having to have everything in perfect shape. These people may also be extremely scared of germs and contamination and will constantly wash their hands or clean excessively. These people may repeatedly do things, such as checking the oven and stove to see if they're off, or after leaving for work, they might drive back to their house just to be sure that they lock their door. People with OCD have the mindset that makes them think they have to do everything the exact same way every single day. Here's an example. A person with OCD may think that if they don't put their clothes on in the exact same order every single day, then something bad will happen to them, someone they care for, or someone they love. OCD can affect a person's social life and make them paranoid. People with OCD should seek medical treatment. If you know somebody with OCD, you should be non-judgmental, because this may make them feel ashamed. OCD can be helped, but it's up to who is willing to help them. Those were a few of many forms of anxiety. I hope I opened your eyes about people with anxiety and the possibilities that you or a loved one may have it.